I'm joined by Mark Prete. He is the president of the Hartford Healthcare Medical Group. Welcome. Thank you for being with us.
Good morning, Kara.
So the Hartford Healthcare study, in conjunction with MIT, has been studying when we're going to hit the peak in our area. What's the latest date now?
We're still looking in our modeling the end of April, first part of May. That seems to be where we're targeting.
So is the social distancing working?
Yes. I mean, clearly, we think it's working. It does not mean that we can't let our guard down because we're still seeing rise in hospitalizations. So yes, it is definitely working.
So the Connecticut Army National Guard and the Connecticut Air National Guard both transformed the Connecticut Convention Center in downtown Hartford over the weekend into a COVID-19 field hospital. Can you tell us how Hartford Hospital is going to be operating this?
Yes, thank you. It was really quite amazing. So Hartford Healthcare, in partnership with the Army and Air National Guard, did construct a 600-bed hospital at the Convention Center over the weekend. It was really kind of extraordinary that we put it up in a few days. So Hartford Healthcare, it will be annexed as part of Hartford Hospital, and those beds will be available and operational and staffed by our physicians, APs, nurses, and support staff.
And what type of patient will be treated there?
We think that the best utilization of this alternate site would be if we entered a COVID-19 surge, then there's two types of patients. One are patients that are in the hospital that are convalescing from their acute illness who may not have a place to go to or home, and so this would be an alternate site for them to be in. Secondly, there may be patients coming into the hospital that need observation or more level of care, but again, don't have anywhere else to go to, and our hospital may be full. So those are the two opportunities we see.
So a lot of people are still concerned about testing. Can you explain how this hotline could perhaps help diagnose COVID-19 or prompt a healthcare provider to get someone tested?
Thank you. Yes, the testing criteria we're using have not changed dramatically in a couple weeks. We are trying to find out what patient populations are at risk. So right now it really is patients that are over 65 with symptoms, and then a population of people that are immunocompromised or at risk for, let's say, cancer and other reasons. That's the population we're targeting because they're at risk, and we want to make sure that we know whether they're COVID positive.
And I know we're hoping to get more testing up and running soon. Governor Lamont has said that should happen, so we'll have to keep informed. Thank you so much for being with us. Before I let you go, how effective has the telehealth been during this pandemic from your perspective?
It's actually been pretty amazing. We just broached 30,000 visits in about 2 weeks. So we were able to really pivot quickly and go virtual with almost all of our medical group as well as in-hospital. We actually rolled it out to skilled nursing facilities last week. So we're providing virtual health in our skilled nursing facilities, and we plan on doing it in home care as well. And lastly, we're just now piloting our ICUs the ability to do virtual health in our ICUs.
Thank you so much, Mark Prete, for being with us, and let's hope you don't really need a lot of that convention center space in the future.
Thank you, Kara.